Attention, please. Hello, everyone, and welcome to the Daily Dose with Doctors Ken and Ten. And today we have a controversial topic, mostly for us physicians, and that is who should be called doctor.
You guys, I got my army fatigues on because this is a hot topic.
It's a hot topic for me, and I'm going to tell you why. Because I think only an MD or DO should be called doctor.
Ooh, I'm noticing, Dr. Ten, that people they think everybody's a doctor, except if you're melanated. If you're melanated, you're always a nurse. Okay, I am a nurse till kingdom come. Okay, I get it, whatever. But what I'm noticing is now that everybody is seeing mid-levels, what is a mid-level? A mid-level provider is somebody who normally needs oversight from a physician. And what we're finding is everybody's a doctor. So if I see a patient, they'll be like, you know what? Well, the doctor told me that I'm going to do this, but they don't know that they're actually referred to me because I'm the doctor, and now I'm going to change the game plan. And even myself as a physician, for years, you guys, for years, when I went to the eye doctor, I thought I was seeing the eye doctor. But no, I was seeing the optometrist. And so, but I still call them a doctor. You know, if you got your doctorate in anthropology, are you Dr. So-and-so?
No.
You know, what's the difference?
If you get a PhD, you should be called professor. If you have a degree in optometry or dentistry or podiatry, I think you should be called that title and then your last name. I don't think you should be called a doctor because that implies that you are a medical physician who is equipped with giving medical advice, who is equipped at assisting in medical emergencies. And I think that it's a falsehood to say you're a doctor when in fact you are not. And I don't think that anyone should be called doctor unless they have an MD or a DO. Jill Biden refers to herself as Dr. Jill Biden, and I think she should not. I think she should not be doing that. Now, obviously, there's no law that's going to say you can't call yourself what you want to call yourself. But I think people should take a little bit of personal responsibility and say to themselves, if I'm not really a physician, I should not be touting doctor around as if I'm able to give medical care.
Well, I do want to read the Oxford definition of doctor.
Let's hear it.
Doctor, a qualified practitioner of medicine. Doctor.
Done.
So going back to what you mentioned, a podiatrist. I've been to a podiatrist, and they're the doctor of medicine for the feet.
Well, are they the doctor of medicine? Doctor of feet? Maybe not doctor of medicine. Unless you got a medical degree, then you ain't a doctor. Why are we trying to be nice about it?
My chiropractor is Dr. So-and-so.
Absolutely not. Absolutely not.
So then what would they call themselves? What would podiatrists call themselves?
Podiatrist Johnson.
Anesthesiologist Cole. Okay.
You can be an anesthesiologist, but I have a medical degree. I'm a doctor. I wouldn't call you gynecologist a girl, but if you did not get a medical degree, you ain't no doctor. Anthropology. Okay, so let me ask you this.
Sure.
If you were on an airplane and you grabbed your chest with crushing pain and it radiated from the left side of your chest up to your neck, down your left arm, would you want a podiatrist or a doctor of medicine? Would you want an anthropologist, a sociologist,
right,
or a doctor of medicine? I think then everyone would agree they want a medical doctor. Even a person who holds the doctorate in economics.
Right. Yeah.
That person would tout, I'm a doctor, but if they needed one, they surely wouldn't say, I got this. I know what to do.
Well, definitely crushing chest pain. I'm going with the Oxford definition of doctor. Okay. But That's a lot of controversy. People do take offense. I know we all work hard for our degrees, but this is just a matter of nomenclature, and it does cause confusion for a lot of patients. And a lot of people don't correct anybody because we're tired, just like myself. If I introduce myself as Dr. Cora, you see doctor here and you still calling me the nurse, I just want to just give you care and go on to the next patient. So I don't think this is a disrespectful topic. I think this is a must-have topic that people don't like to talk about, because the purpose is knowing who you're seeing.
I think too, with everyone being called doctor, it waters down the degree. I think in when I say waters it down, it's like, how when we started this conversation, you're like, well, everybody's a doctor. Then there's no more importance to the title, right? People work really hard for that medical degree. And I'm going to point this out, particularly people of color and women, who very often get overlooked in professional settings as being doctors. Like you said, when someone sees you coming, they think you're the nurse, they think you're the, an MA or something to that nature. So we already, as minorities, as women, we already get overlooked in our own profession. So to water it down to like it not being a big deal because everybody's a doctor, just, I don't know, it makes it hurt a little bit more, right? Like, we work this hard. I want you to know I'm a doctor. This person is not. I am. And I think that not giving credit where credit's due, or properly giving credit, it's misrepresentation. But, there's a little bit of disrespect on that. It's just a little bit.
You have to know who you are seeing.
Yeah.
Okay.
There's fake news out there, fake news and fake information. It's important. Names are important. Titles are important. You need to know who you're talking to.
Okay, on that, Dr. Chen just brought up a good point. There's a lot of fake stuff out there, and especially with the rise of media. The whole reason why I jumped on media in medicine is because there's a lot of people that have given themselves credentials and that are treating things and taking people's money, and they shouldn't be. Yeah. What are your qualifications? Okay. And so in everything, or what is your certification? So relationship experts, I know, a lot of times experience can make you a relationship expert, but some people actually went to school, got a degree, and then got certified. So it's kind of like in this era where information is more abundant than ever without sources, we got to know who's who. And so the question is, you're a doctor, but you're a doctor of anthropology.
Of what? Exactly.
Right. What do you do? What is anthropology? I don't need this right now. You know what? This conversation is getting wild. And I know some of y'all listening to this is like, I'm a doctor. What's up, Dr. Ken and Tim? We about to have it out.
Let's have it out.
We invite you on this platform to talk about it.
Truth be told, if you were on the other side of needing a real physician, you would want a physician. If you ask for a doctor on a plane, you want a medical doctor.
And on the flip side,
and I think that, if that would it would be just as bad if I were to call myself a chiropractor or to call myself a dentist. I mean, it's just factual information. There's no disrespect in calling someone what they really are. And anything other than a medical doctor is not a doctor. So
you know what? Let us know your comments. Let us DM us if you want to come on this platform and state your case. Again, so who's the doctor? For sure, you were Doctors Ken and Ten today. Until next time, doses. He was like, the Daily Dose.
Was that your shout out? Because it might get cut.
My earrings would like to say hello again.
ED.D.
ED.D. Never heard of it.
Anyway, Segura.
Okay, yeah, say that last name again.
Segura.
Okay. I am the doctor of the bikini area.